Hello and welcome. My name is Edel Murphy and I'll give you a brief introduction to the PPI Ignite at NUI Galway programme. We're familiar with the traditional approach to research, where some of our brightest and best are involved in research, young early career researchers, others who have dedicated a lifetime to research, who conduct excellent research with important outcomes that influence health policy and healthcare delivery. Researchers work in labs, in offices, in the field. We're very good at collecting data from research participants, good at measuring health indicators like blood pressure, taking blood samples, good at conducting surveys, at completing questionnaires. All the time we're taking from research participants. Researchers are excellent at presenting at conferences, mainly to other researchers, and at writing papers that are published in academic journals and at producing reports. Some, but not all, researchers are effective at knowledge translation, ensuring that research results influence policy decision making. Public and patient involvement in research requires researchers to take a different approach to their research, to work with the public and patients to understand and get their perspectives on research. For example, if looking at a potential new treatment for stroke survivors, what outcomes should we measure? What matters most to a stroke survivor? One study planned to measure change in length of hospital stay as the primary outcome, but when stroke survivors and their families were asked, they said what mattered most to them was the length of time the stroke survivor was able to live at home after hospital discharge. Responding to this patient input changed the trial significantly, but the outcome measured was what mattered most to those living post-stroke and to their carers. You may be familiar with this definition of PPI and the slogan, "Nothing about us without us," from the Involve organisation in the UK, who are the leading PPI organisation in the UK. The message to researchers is, from the public and patient, if you're planning to do research about us, well, let us work with you and tell you how it is from our perspective. PPI in a research study can take many different forms. PPI activities can be described on a spectrum, with no patient involvement, perhaps the traditional model in research, at one end, through consultation to increased public patient involvement in research planning and decision making, aiming ultimately for the development of full and equal partnerships between researchers and the public/patients/community groups, working together to initiate and conduct research studies. All PPI requires education and training in PPI, building PPI capacity in both academic and public partners. So what is the PPI Ignite programme? PPI Ignite is funded by the Health Research Board and the Irish Research Council and has the overarching aim to build PPI capacity across Ireland and to support increased quality PPI activity in health and social care research. 5 universities are funded under the programme. Here at NUI Galway, we are building on some excellent examples of PPI by specific research teams, and with this programme we'll be working with our PPI Ignite partners, with the public, with patient organisations and with health and social care researchers across the university to bring about a culture change in how research is conducted at NUI Galway. This is a very ambitious target, likely to take more than 3 years funded under the PPI Ignite programme to achieve. But success for us will be when involving public and patients from the beginning becomes the norm for all researchers at NUI Galway. The PPI programme involves a core group of academics at NUI Galway and a number of partner organisations, including CRE, Jigsaw Galway, the Alzheimer's Society of Ireland and SAILTA, the hospital group. We also have a number of international academic partners with PPI expertise. We're setting up a public advisory panel and a PPI catalyst programme across the university, and we will work with researchers from all disciplines who are involved in research with human health outcomes and with members of public and patient organisations. The PPI Programme Office, led by Principal Investigator Professor Sean Deneen, is at the core of the programme. Sean, an endocrinologist and currently the National Lead for Diabetes in Ireland, is leading an innovative research programme developing a new model of healthcare for young people with diabetes. A young adult panel partners with the researchers at the core of this work and has been involved in the development of this research programme for a few years. I'm Edel Murphy, the PPI Ignite Programme Manager, and Martha Killalay is the Research Support Officer. The PPI Ignite programme has 3 functions. In education and training, we will deliver significant PPI training for researchers and for the public, focusing on the skills required to create and sustain partnerships and to work together to ensure the voice of the patient influences our research. We will provide support to individual researchers and research teams on specific aspects of PPI activities, including providing support and advice to researchers during grant application process, when trying to set up PPI groups, and at all stages of the research process. In our evaluation and impact function, we're conducting some research around the best methodologies to use to measure the impact of both PPI in individual studies and the impact of the PPI Ignite programme. This gives you a brief overview of the PPI Ignite at NUI Galway programme. There's currently a good momentum building around PPI across our university and in Ireland generally. We look forward to hearing from you, so please get in touch.